I'm Aaron Gow and I'm here today in Salford to see how Jeremy Tankle and the team at Clarendon Surgery have made it quicker and easier for patients to access services.
Problems with you have here is you ring up for an appointment and it'd be 24 hours or as soon as an appointment came available.
It was a bit of a nightmare. The phones were very busy at 8 o'clock. We would have 100 slots that opened on the day, but by the time, say, 20 past 8 came, those slots had already been filled. And then the people that still wanted seeing were just having to be told to ring back the following day and try again at 8 o'clock.
The staff couldn't cope with the volume of calls, the patients couldn't get through, and sometimes, literally, the telephone system would crash. Our surgeries were booked and we'd have telephone calls. And we as GPs were really stressed at the time.
The surgery realised something had to change, so they introduced a new telephone appointment system.
60% of the patients don't need to come and see us in order for their problem to be satisfactorily resolved. If a patient wants to see a doctor face to face, they have to speak to us on the phone first.
And we've had to kind of retrain your patients to stop ringing first thing at 8 o'clock. So the calls are spread out over the day, which is better for us.
The people that you tend to bring in are either quite quick and easy to see, they need a simple examination. And also you bring in sometimes very complex patients in whom it's impossible to resolve on the phone. The staff took to it quite well. They no longer had to say no to a patient. They no longer had to say, we have no appointments, phone back tomorrow.
We try to see everybody, we kind of deal with everybody on the day. So we don't have any pre-bookable slots. We tell everybody to ring on the day that they require something.
Between 80 and 90% of the patients who want to be seen on the same day are seen on the same day. Very often patients will phone up and they'll say, when can I have an appointment? And you'll say, how about 3 o'clock? And they'll say, today. You can hear the surprise in their voice.
By using the practice's data, we can see how the changes they've introduced have resulted in a series of improvements. In the first month, it took almost 3 hours for 90% of patients to be called back. With the number of tests of change, over the next 3 months, this was improved to perform at nearly 2 hours. These improvements included realising that not all patients can be treated over the phone. If telephone consultations looked as if they were going to take longer than 5 minutes, then these were patients who needed to visit the surgery. Staff quickly got better at using the system, having never done anything like this before. Patients began to change their behaviour and started to trust the new system. Any patient who expressed concern or dislike of the changes spoke with a clinician or the practice manager to find out their concerns and experiences so the practice could learn from feedback. And the initial flood of calls at 8 AM began to be spread across the day, making it much more manageable. But 2 hours wasn't good enough. As we can see from the data, the practice's test of change showed an improvement from April to May 2013. To achieve this, they introduced individual callback lists for doctors in the morning and a communal list in the afternoon, and a break between 1 and 2 PM when no calls were taken. Again, patients responded positively to the changes. In this period, half of patients were called back in less than 2 hours. However, the practice felt the system could still work better without relying on goodwill and hard work. They tested and implemented, giving doctors individual call lists in the morning and afternoon. No calls between 12 and 2 o'clock, except on Mondays when they were the busiest, and additional doctor time on Mondays to cover the extra demand. Now, the practice has a system which enables 90% of patients to be called back within 55 minutes. This is a massive 2-hour improvement since the start of the project. When we drill into the data, we can see 54% of patients are called back within 20 minutes or less, and 71% in 30 minutes or less. Most importantly, this fantastic improvement has been sustained. Patients can call up and know when they will be treated. Now, 93% of patients find it easy to get through to the surgery on the phone. 92% felt they were able to have an appointment with someone when they last tried. 93% of patients are satisfied with the surgery's opening hours. And 87% of patients would recommend Clarendon surgery to others.
There are less non-attendances because people ringing up on the day tend to turn up if they're given an appointment.
For myself, it's quite simple. We're getting dealt with by the doctor there and then the same day. It's given us a better service.
I've got no doubt that this system is a safe system. When you compare it to a system where you can't get through to the doctor at all, and so therefore care is being rationed, if you like, by non-accessibility, I don't believe that's a safe system. On a personal level, I actually believe we're offering a better service.